Childhood Obesity, a presentation by Amanda Vertel. Obesity leads to many chronic illnesses that are largely preventable. Obesity is associated with significantly increased risk of more than 20 chronic diseases and health conditions, which include, but aren't limited to, heart disease, diabetes, high blood pressure, musculoskeletal disorders, and even some cancers. Around 3 million adults die each year due to being overweight or obese, making the correlation of being overweight with chronic diseases the fifth leading risk of death globally. In the United States, 21% of medical spending, or $190 billion, is attributed to obesity-related causes each year. These expenses are absolutely egregious for an issue that can be curbed through community outreach and lifestyle education. The patterns of childhood obesity include upbringing in a low-income area. A child that grows up in a low-income neighborhood is statistically more likely to have weight issues growing up. Strategic marketing gears sugary, colorful foods towards younger children by placing them on lower-level shelves that are at their eyesight. Black and Latino males account for the highest percentage of overweight or obese children, according to Skinner. Single parents struggling to afford housing, food, and other expenses are one of the main reasons to bring up a child in a low-income area. More than 15 million children experience food insecurity annually, where their family has limited access to adequate food and nutrition due to cost, proximity, and/or other reasons, according to Malhotra. Effects of childhood obesity include excess spending on healthcare over the course of this child's life into their adult years. Overweight and obese children account for over $14 billion healthcare dollars spent annually due to issues directly driven by their weight. An obese 10-year-old child who continues to gain weight throughout adulthood has lifetime medical costs that are $19,000 higher than a healthy weighted 10-year-old who maintains a healthy weight throughout their life. Asthma, diabetes, heart problems, cancers, high blood pressure, and even bullying in school can all be effects of obesity and overweightness. Technology like iPhones, tablets, and television don't promote physical activity. Access to affordable food that is healthy is not readily supplied in lower-income neighborhoods, and the ready-made foods that are packed with preservatives, refined sugar, high amounts of sodium, and carbohydrates are all too prevalent to find in local convenience stores. Nearly half of infants and toddlers under 3 years old live in low-income families. 24% live in poverty, and 6.6% of the United States population lives in deep poverty. And that's according to Skinner. Community support is important in the role of implementing interventions and organizing events like farmers markets, races, marathons, healthy food festivals, and getting health messages out to the public. The community can help bring healthy food markets to the area and promote healthy eating habits to children and parents. Communities can also make neighborhoods safe and accessible for physical activities like sidewalks to walk to school, bike paths, playgrounds, basketball courts, soccer fields, and organizing community playgroups. The more that is available to the community, the more likely it is that kids will get out and play, especially if they see that their friends and neighbors are enjoying playing outside. Farmers markets would make it easy for people to get fresh produce each week, and community races could benefit the community by providing a physical outlet, doubling to serve a good cause. Since children spend the majority of their time at school, it seems appropriate that they be educated on the importance of healthy eating habits as well as the importance of getting enough exercise. Nearly 100,000 schools serve lunch to 30.4 million students each day, with 22 million of these lunches being free or at a reduced cost. 90,000 schools provide 14.5 million breakfasts to children, with 12.4 million being free or at reduced cost. Schools that provide healthy and balanced meals to students ensure that these kids are getting at least one nutrition-rich meal that they may not typically receive at home. A primary method of combating obesity is to prevent it through education and setting an example. Since many kids eat 2 out of their 3 meals at school each day, it is important to provide them with wholesome and nutritious meals. They may not get a healthy third meal at home or even get a meal at all. A secondary means of intervention is to provide access to resources that aren't readily available in some neighborhoods. Building safe play areas for kids to get their energy out is important to have in communities. Providing sidewalks encourages walking to school, the store, and neighbors' houses. Sidewalks promote walking, and play areas encourage kids to play outside with their friends after school. By bringing farmers markets to low-income areas, it provides access to fresh foods that aren't commonly found around these neighborhoods. Community races not only bring people together as a community, but also encourage physical activity. Schools within these communities, and all communities for that matter, should provide healthy breakfasts and lunches. Millions of kids eat breakfast and lunch at school each and every day, so it is especially important to make these meals full of nutrition. Michelle Obama's Let's Move campaign is dedicated to solving the challenge of childhood obesity. The campaign also provides parents helpful information and tips on how to make healthier choices, as well as providing healthier food in our schools. She implemented Let's Move cities, towns, and counties to assist local officials in building healthier communities. Over 81 million people have benefited from this program. In partnership with the United States Department of Health and Human Services, Michelle Obama's Let's Move campaign launched Let's Move Childcare, which ensured that over 1.6 million children received more nutritional food, more physical activity, and less time in front of a screen. People that work in public health can only do so much to combat the effects of childhood obesity. Much of the responsibility lies within the parents or the guardians. If the parents and guardians don't have the resources necessary to understand the long-lasting consequences that these bad habits have, it is not likely that they will be willing to prevent it. The community and schools must get involved because the child's future depends on it. Thank you for watching.